I don't like the term balancing hormones because you don't really balance them, right? So what
Okay.
happens is everybody's cycle, the first half of your cycle, everything's kind of suppressed. Your estrogen starts to go up, you ovulate, and then your estrogen and progesterone stay elevated. Then they
Mhm.
have a big drip, they have a big drop, and then you have your period, right? So they're not ever consistent. They're never going to see where your hormones are always like this. However, during perimenopause, they're like crazily sporadic.
Hey,
Very good.
Celeste, thanks for joining.
Hello, you guys. I'm so excited to be here.
Yeah, thanks for taking time out of your really busy schedule because we know how busy you are.
That's okay. You know what? I think it's really important to get some, information out there. So it's worth it always.
Yeah, exactly. And a lot of our listeners are women, obviously, like I would
Mhm.
say 99%
Right.
of them, right? And
Yep.
a lot of them are in this age range where they're going through perimenopause and sometimes they don't know. So
Yep.
we kind of want to
Yep.
talk about that during this process. But
Mhm.
before we start that, so you specialize in this, but what inspired you to go so
Mhm.
deeply into this area?
Right. So I knew I was always interested in hormonal health. I just wasn't sure that it was going to be perimenopause because obviously, I mean, I turned 30 in a few weeks. I'm not even close to menopause yet, luckily. But I think seeing my mom go through it and then all these patients that were coming in like women and they just were not getting any sort of help because we know how women's health is in the medical
Mhm.
system. It can be kind of thrown to the wayside. And they would come in, they'd be dealing with like they just don't feel like themselves, they feel like they're so irritated all the time. So their relationship is really like tainted with their partner. Their kids are getting older, moving out of the house, and then you have aging parents. So it's basically just like, you know, chaotic scenario for them, not just with the hormonal changes, but with their life changes going on as well. And I find women just need so much support during this time, not even just from a hormonal side of things, but from, working on the foundation side, right? Because then people are gaining weight during this time as well. And or they can't lose weight and they're losing their minds. And I'm like, oh my goodness, don't worry, I got you. It's because you can't do the same thing you were doing your entire life, right? But you don't realize because it's such a small, like, not small, but it can be such a gradual transition. Like some women can start perimenopause as early as 35, right? They can start going through it. And then, the average age is closer to like 45, right? And then menopause is 52. But again, like you could be dealing with this for 10 plus years more.
Yeah,
And
I
I see
know.
women that are right. So that's why I'm like, you know what? These women are struggling. I need to do something. So that's what inspired me to do that.
I love
Yeah.
this.
Yeah,
I
we're
feel
we're
like
actually
this is
10 years
like
apart, so she's
Yeah.
not I don't I feel like Whitley's going through a different phase than I am, like, I'm 45.
Yeah.
I feel like I don't know how to talk like, I can't really talk about the same things as her because she's
Mhm.
10 years younger than me, but
Mhm.
I don't even know if I'm menopausing or perimenopausing, so,
Right. And
yeah,
you
let's
might
talk
Ooh,
about that.
the thing is,
yeah.
like, in the conventional side, they're basically like, well, if your periods are still regular, you're not perimenopausal, which is not true. Like some women have regular periods right up until they go through menopause. And so definition wise, perimenopause is the entire time leading up to your last period, right? And then menopause is technically only a day. It's the day of a year past your last period. I know a lot of people don't realize that, right?
What?
So menopause is one day and then you're postmenopause. That's it. One day of menopause, then you're post. And
And
that's
10
the
years of
definition
chaos. Yeah.
or more. Again, I see like 65-year-olds come in sometimes with hot flashes still. Like it's wild because some women don't go through it till later. Like I have some women that are bleeding and they're almost 60. They're still having periods
Wow.
because everybody's so different. And that's why you can't just kind of fit everybody into one small package and say, here's your treatment plan for this one person. Like it's so individualized. And again, like with all the other things happening in women's lives, like, or like the women that are having their kids later, now they're dealing with, not babies, but like preteens and they're going through menopause and they're like, oh my goodness, what do I do now? Or they're moving out, they're having empty nest syndrome. Like it's just wild. It's wild. So then your cortisol is just going through the roof at the same time as your hormones going like, and I don't think a lot of women realize that, you're thinking perimenopause, you're kind of thinking your hormones are still regular. And again, everybody's cycle, like I don't like the term balancing hormones because you don't really balance them, right? So what
Okay.
happens is everybody's cycle, the first half of your cycle, everything's kind of suppressed. Your estrogen starts to go up, you ovulate, and then your estrogen and progesterone stay elevated. Then they
Mhm.
have a big drip, they have a big drop, and then you have your period, right? So
Mhm.
they're not ever consistent. They're never going to see where your hormones are always like this. However, during perimenopause, they're like crazily sporadic. So, for example, your estrogen one day might be at an 800 level, which is pretty high. And then the next day it might be at like under 100. Like it's that
Mhm.
crazy during perimenopause. So it's not as consistent. Like that
Mhm.
cycle that I just explained, it's not as consistent during perimenopause, even if your periods are regular. And that's why you have all these symptoms because you're like, one day you're like, I'm going to kill the person who I'm driving behind. And then the next day you're like, no, I'm fine. Like, but I would say like that's one of the main concerns that I see is irritability, which has a major impact on your kids. It has a major impact on your partner. Like it's just wild. And then again, the biggest thing is that they don't feel like themselves. And that's why I'm like, okay, like that's why. It's just easier to explain it in that manner because it kind of sticks with people more.
Mhm.
And that a lot of women also start to have sleep issues during this time. And that's because there's a huge drop in progesterone,
Okay.
right? So waking frequently in the night, is that happening to you,
My
Sherry?
gosh, both
Yes.
of us, Celeste.
Both
It's
of us
happening to
know.
Hey,
both of us right now, and I'm
girl.
like, "What the hell is happening?"
It's probably especially that 3 to 4 a.m. wake up time that
Yeah,
everybody has. They're like, why am I
Yeah.
awake right now? Like the witching hour, like,
Yeah.
it's a menopausal witching hour.
I'm
girl,
like, am I
I've been
supposed to be
waking up
manifesting
between
right now? Like,
3:30
what's
and
happening?
3, like 2, 3, 2, 3, like, every night almost, and
Yep.
I'm wide
Yep.
awake, and it's taking me,
Yep.
like, hours to go back to sleep. It's
Exactly.
like
And that's typical,
yeah.
right? It's wild. And that's usually a progesterone issue. So your progesterone is really good for mood balancing, but it's also really good for sleeping. So as that starts to decline, as you get closer to menopause, your sleep becomes just crazy or you
So
can't
is that
fall
something
asleep. And
Is it something that, like okay, so the fact that, like, I'm experiencing it, Sherry's experiencing it, and I can imagine there's so many other women that experience that too, and they're, like, wondering, like, "Why am I waking up in the middle of the night? Why can't I get back to sleep?" Are there things that we can do to support like you said, I don't like using the term of, like, balancing hormones, but are there ways that we can support those hormones as, like, we're going through some of those shifts?
definitely. So, I mean, the obviously the number one thing to help with sleep for that aspect would be hormone replacement. So, it would be progesterone therapy taken before bed. But, there's also that cortisol scenario that's happening around this age from all the things I explained beforehand. So, that would be things like if you're waking up with your mind racing, for example, or before bed, if your mind's like, who, or you wake up and you're like, okay, I got to do this tomorrow, this, like it's going
Yeah.
crazy.
Yeah.
Also working on cortisol lowering is important because again all these life changes are happening, so your cortisol is probably higher than normal. You're probably feeling more like amped up almost. So by decreasing that and leveling it out, that also helps with going to sleep. Obviously things like sleep hygiene, which you're probably already familiar with because
Mhm.
so many people are like this on their phone day before
Yeah.
they go to bed, which is a no-no because it's just spiking everything and it's actually decreasing your melatonin as well,
Oh.
right? Yeah, blue light really disrupts your melatonin production. So ideally, if like 30 minutes to an hour before bed, you'd be completely off of any blue lights. So that's
Okay.
TV, that is, your phone, that's any sort of screen. Kindles aren't so bad. I always have that question, but the light's a bit different in a Kindle. But if you're, because I know like I read on that too, so I get it. But if you're taking like a hot shower before bed instead, or
Mm.
meditating, if you can do that, or like listening to a relaxing audiobook, the amount of women that are listening to like horror audiobooks or murder. I'm like,
Right.
guys,
Because that goes into your subconscious too, right?
yes,
Yeah.
it's just upping your cortisol more. I understand, like I love it too. I understand, but it does spike your cortisol still. So it's like, hey, listen to something relaxing if
Oh my
possible.
god, it's so funny you say that because like, a few nights ago, Whitley sent me this audio, and she was like, "You put this in your earbuds or whatever and go to bed."
Yeah,
Like and it was, like, a whole, like, affirmation type calming
yeah,
stuff, and she's like, "Your
yep,
subconscious will pick that up, but Craig likes to watch the news or sports or
yeah.
some kind of, like,
Yeah.
Stimulating.
stimulating stuff," and I'm like the other night, I was like, "Listen, I need you to turn the TV off in the room because
Yes,
I
TVs in
don't
the
want
bedroom are
that."
not good.
If they're not, but I love
Yeah,
it, but I see what you're saying. I see what you're saying.
I know, and the thing is, like, you have to kinda just, do what actually is going to work with you.
Right.
Right. Like if you know that you're the type of person that needs to watch TV to relax, that's just something that I think society has programmed
Yeah.
into us. But
It's programmed.
anyways,
Yeah.
I just start with like, 20 minutes before bed, turning it off then and just see if it makes a difference. Right. And just start doing some of
Yeah.
those relaxation techniques and see if that actually helps you just go to sleep and stay asleep because your melatonin will start to increase. Same with lights. You don't want
Um,
to be around a whole bunch of lights either before bed. It's the
mm,
same kind of scenario. So like dimming lights at night is also very important. And I really think, and I'm not saying go take melatonin, like, it can work, but that's only really good for falling asleep anyways.
yeah.
It doesn't help you stay asleep regardless.
No,
And
no.
another thing that also disrupts women's sleep is like some people get joint aching and pain at this age as well. And it's not just arthritis. Like everybody's always like, well, I just have arthritis. I'm like, are you sure it's not your estrogen levels declining? Because I've had women that come in with pain everywhere. It's like just so much joint pain. They've seen chiro, they've seen physio, they've got massage, nothing is working. And then they get put on hormone replacement, it's gone.
Wow.
Just like that. Because you have estrogen receptors all over your body, right? They're not just in your ovaries, they're everywhere,
Yeah.
right? So it's really important for your joint as well. You just don't realize it. Like frozen
How much
shoulder is a big one.
I'm
Really?
really curious too, Celeste, like how much do you incorporate nutrition in with the
Mhm.
whole picture of like the
Yep,
hormones and everything?
always.
Yeah.
Always. Like every time somebody comes in, like I always go over the entire diet that they have. And I would say 95% of the time women are not getting enough protein.
Okay.
Like, of
Okay.
course, fiber is very important too, which again is a big thing for women. But I find that there's so many women that just are not getting enough protein. Like, I would say the average that I see is like 50 grams a day. You should minimum be getting 100, like
Can you
minimum. And
explain why that is important?
yeah,
Like
I mean, it helps
protein?
with exactly. So it really helps with like maintaining that muscle building, which is really important for bone health in the long run. It's also really important for how your brain functions. So if you're not getting enough, you're going to be filled with brain fog. You're going to be lethargic all day. Like, especially at 2 p.m., like it
Yes.
happens a lot because the amount of times I see women like, oh, well, I run, I go to Tim's on the way to work and I grab a bagel with cream cheese. I'm like, so you're just getting straight carbs and fat in the morning, like no protein. Like it happens all the time though. Like, or just coffee in the morning. Yep.
I'm not
Yep.
here.
And if you have that's the problem though, because if you're just having coffee and let's say, your adrenal glands are already on overdrive
I
because of
sip my
all the stress
coffee.
happening as she sips her coffee. It's okay. It's almost 12. It's fine. The problem is your cortisol is already spiking first thing in the morning. So that's part of what's waking you up.
Okay.
Right. So it's the highest in the
Well,
morning. And then if you're also adding coffee on an empty stomach for nothing to absorb it, it's just going to further increase that cortisol, which can just
ugh.
set your whole day up for just crap because you're going to have a crash earlier in the day.
No, okay.
So
Gotcha.
that's part of it. So the biggest thing you can do is even if you just have a little bit of protein before you drink coffee in the morning, like that could be, like an egg or it could be a little protein shake, like hopefully something that you make. I don't really like ones you can buy at Costco or anything.
Yeah.
But again, like or like yogurt, like Greek yogurt or something. Like just you don't have to have like, 400 calories
Okay.
worth of even if you have like 150 calories, like a small amount,
Something
there's something
small.
on your stomach
Okay.
that's going to help with that cortisol spike as
What are
well,
your
right?
what are your opinions on intermittent fasting?
So it can work for some women. Like I'm not against it. Most research on intermittent fasting is on men. Shocking. I know. Like obese men with type 2 diabetes is what most of the research is actually on.
Okay.
But there's some women that really feel good on it. The problem is you do have to be careful with fasting as we age because you do need food, obviously, to make hormones. Like, because their hormones are made from cholesterol, right? That's why this whole cholesterol scare is crazy sometimes
Yeah.
because it's actually helping to produce the actual hormone, right? So if you're fasting and you're not getting the appropriate nutrients, then you're just going to feel more dragged down. And this is especially true if you do have like a cortisol issue, let's say. So if you're really stressed out all the time and overwhelmed, and then you're also putting this on top of it, your body's already in fight or flight, and then you're not eating, your body's just going to go absolutely berserk. But like if you're
Okay.
a really calm human and you don't have any issues and it works for you, hey. But I would say most women in perimenopause should not be doing intermittent fasting for that reason. But
Okay.
again, it's different if you have type 2 diabetes and you're perimenopausal or something. That's a bit different. It depends if there's comorbidities or if you don't have any other health concerns, right? So it's very
Okay.
individualized for that reason.
If you were to like break it down, Celeste, into like your top 3 things that women can do to sort of like support their
Mhm.
transition as they're going through perimenopause, what would be those top 3 things that they could implement?
Yeah, so number 1 is weight training for sure. Like
Okay.
100% hands down, that's the best thing that you could be doing for your bone health, for your brain health, like everything. And I'm not saying you have to, go to the gym and start lifting like, squatting 205 or something. You don't have to go crazy here. But if you go and start doing resistance training, especially if you're a beginner, if you just start with bands, for example, and body weight,
Mhm.
that over time will lead to more weights because you want that resistance on your bones and your muscles. So that,
Okay.
because the problem is when we age and our estrogen goes down, our bone health starts to decline. So it actually starts to degrade. And that's why so many women end up with fractures and osteoporosis once they're
Okay.
postmenopausal, is because of their bone health. So if you don't have a good foundation going into menopause of weight training, it's going to
Huh?
be a lot harder to get into it. For one, you're probably going to be, in more pain. It's just a recipe for disaster. So I urge all women like early on to start
Okay.
to
Okay.
start with weight training as soon as possible, even a few times a week, like 2 to 3
Yeah.
times a week, you know what I mean? So that would be my number 1. And then, second definitely would be making sure you're getting enough protein for sure. Like I was saying, just to help with your brain health and
How
to
much
help with
protein
muscle.
should you have?
So it really depends on the person. As a rule of thumb, I say minimum 100 grams,
Minimum. Okay.
minimum, because it depends on your weight.
Mm.
Really? So what I do for a lot of women is I calculate their macros for them. So, if someone, they because I actually see a lot of women don't eat enough food a lot of the time. So there's so many people that come in, they're overweight, they can't lose weight, and they're like, well, I'm only eating like basically I do a rough calculation, right? Because I'm not going to sit there and calculate it for real. But if they tell me their breakfast, lunch, dinner, and any snacking, most women either A are only getting like 1,200 to 1,300 calories a day, which is insanely low. It's like a toddler. My toddler
Wow.
eats more than this.
That
That's
is
what I'm saying. That's
low.
nothing.
Very
Yeah.
low.
Starvation mode.
Yeah.
That's why your body's not losing weight though. Your body's literally in starvation mode. It is
Yeah.
holding
Yeah.
on to everything that you give it. How are you going to lose weight? Your
Yeah.
metabolism is
Yeah.
it doesn't even exist right now. It's so
Right.
slow. I kind of give it like analogy of a furnace. So you got to think of it as like an actual burning furnace. And if you're not giving it enough of that proper wood, for example, let's say,
Right.
which is your nutrition, your metabolism will burn out. Or if you're giving it the wrong things, like let's say wet wood or something, which would be equivalent to like chips and chocolate and just like on like nothing, like no nutrients
Yeah.
whatsoever,
Yeah.
which again, a lot of women do in the evening while
They're
they're
binging.
watching
Yeah.
Netflix because they're not eating enough during the day.
Yeah, and they're not having enough
So they're
protein, right?
starving. Exactly.
Yeah.
And they're starving
Yeah.
at the end of the day because they've only had 1,300 calories and they're like, oh my goodness, I am so hungry. And then what are you going to grab? Carbs. Not
Mhm.
that carbs are the enemy, they're not, but you're going to be grabbing simple crap carbs like chips and chocolate because they're
Yeah.
quick. No one's going to sit there and make themselves a meal at
Yeah,
like,
Yeah.
'cause
9
people
p.m.
think like, "Oh, if I eat less, it's a calorie deficit, I'm gonna lose weight."
Mm,
That's the
mm.
myth, right?
I know, and it's not as simple. I mean, yes, that can definitely help in certain circumstances, obviously, but it's not, especially during that age, it's not going to
Yeah.
help.
Okay.
Because at the end of the day, you're literally just going to be depleting your body like crazy. Like
Mm,
the amount of women that come in that do that, then they start eating more, which again, they think it's like crazy that I'm telling them to eat more. But we do it very slowly. I'm never going to tell you to eat 1,000 calories more. Like usually I start with like 200, like something small.
yeah.
And then they're like, oh, I actually lost 5 pounds in 2 weeks. I'm
Right?
like,
Yeah.
because your body was
I know.
literally
Yeah, that does
all the
work.
time.
It does work,
All the
yeah.
time. I know. And
If
it's
you're
again,
eating
we do.
right. If you're eating
That's
right.
right. That's the key, right? Like I don't say like don't go eat like 200 calories of like chocolate almonds or something. Like go get 200
Um,
calories if you're just eating protein. Perfect.
mm,
Perfect, right? But it's the cravings that people have in the evening, I find, because of that cortisol release. It
yeah.
actually spikes your sugar and your glucose, and then you're going to have a lot of those cravings, which I see all the time. And it's just so, and that's what I mean by like, it's so multifactorial when women come in and we need to work on so much. It's never just like, you just need hormone replacement. Like, it's never just that. It's
No,
like,
okay.
oh, no, you're not eating enough. Oh, you're not getting the right amount of macros. Oh, you're not exercising. You're not doing anything for stress management. Like, it's not so simple as just, and of course, women do not take care of themselves as much. Let's be real. So they're taking care of everybody else.
Mhm.
But then
Right.
they say, well, I don't have time for myself. I'm like, well, you better make time or you're not going to be very useful to anybody.
So true. You gotta fill your cup
all
first,
the
right?
time.
Yeah. So
Yes,
we've
and there's
got
so many women that don't.
so we've got weight training is your number 1. Weight training, protein intake, making sure that you're getting that proper food into your body, like yeah, and then the 3rd one. What's your 3rd
I would
one?
s I would say probably stress management, to be honest
Mm.
with you, and again, you don't necessarily have to be going to therapy, I mean, that will help, but I mean just taking the time out of your day for yourself to actually do something that's going to decrease your cortisol, so whether that's taking a bath in the evening or reading your favorite book or, the problem is a lot of women at this age use wine.
Okay, let's talk about it.
Fair, fair. I understand, like, it's so good, and it does help you feel like, "Whew," but it's not actually doing this inside. It's actually really bad for your cortisol.
Once in a while, right? Once in a while, though.
Moderation is key,
Alright.
always. Yeah,
Moderation.
that's what I mean, but, like, there's so many women that will start going home after work and having a glass of wine while they're making supper
But it's
because it
great,
helps them wind.
Celeste.
It feels
It's
so
great.
good though. Like, I'm
It
big on
does.
I'm guilty on that. Like, at the end of the day, I'm
So
just
is
like, I wanna
everybody.
unwind with a glass of wine and cook a, like,
I know.
meal.
Exactly, and that's the thing that you gotta also keep in mind that alcohol is like a neurotoxin. It's really bad for your whole body.
Okay, yeah.
I
Yeah.
know, and it sucks, and I hate it because I know it and I love wine, I really do, but I also know you need to be really careful with how much you're drinking, right? Like, so anyway, if you're having one every day, depending on the glass,
Right.
because one
Look, guilty.
that's what I mean, I'm like I always ask women, they're like, "Well, I have a glass or 2 of wine," and I'm like, are you going through a bottle in a glass? Like, how big is your glass? It's all the time. Women are like, "Oh, well, it's half of a bottle." I'm like, "Okay, well, that's a little bit more than a glass of wine."
Yeah, that's spiking your cortisol, like you said, like, it's
And your
making you
sugar,
more
and that's
and
in
your
the
sugar.
evening. You're spiking your sugar in the evening, and then they're like, "I don't know why I can't lose weight." I'm like, "It's
Yeah.
a lot of calories, girl. It's a lot of calories." So some of those bottles, depending on the sugar intake, like, you might be looking at anywhere from, like, 600 to 1,000 calories in a bottle of wine. Like, it's
Yeah.
crazy,
That's
and you
insane.
don't realize it.
No.
You don't know that, though, because 'cause you're not
No.
thinking. So then you're like, "Holy
Yeah.
crap, like, I just had a lot of calories just in a cup," and then it makes you snacky.
Yeah.
And then you go to
Exactly.
the charcuterie board and you start eating anything and everything like a girl dinner. So you're having like cheese and crackers and meats and whatever, literally like a
Mhm.
charcuterie board. And then, now you're like 1,500 calories deep extra. It happens all the time. I can't even believe it half the time. Like, it's a lot of calories. Like, but you don't realize because, of course, alcohol is like numbing that. So you just feel like
I
Yeah.
know. And isn't it true that women wanna numb things because
always,
it's a lot of like you said, we do a lot, we put a lot on our plate every day, we have the to-do
always.
lists and maybe, like, managing how we feel better is kind of what you do as well, like, okay, how can we
Yep.
manage your
Yep.
cortisol levels? How can we manage your stress levels instead of going right to wine? What are some
Exactly.
alternatives, right?
Exactly, and that's what I typically do. So a lot of the time, it's just the act of actually pouring a glass of wine that increases your dopamine. So what I do with women, I'll say, get like a non-alcoholic one. There's a lot of crappy ones, but there's also a lot of good ones. The one in the little cans are
Wow.
pretty good, but the bottles are crap.
Okay,
I find
good to know.
anyways. So, if you just kinda, like, pour yourself something like that, and you can even put, like, tinctures in there that have calming botanicals in them, that
Mhm.
helps a lot of women, or a lot of times I'll get women to take, like, L-theanine in the evening, so it's an
Love
amino
that.
acid.
Yes.
Yeah, and it just calms you right down within, like, 15 minutes. I call it nature's Ativan. We love
Mhm.
it. It's not as
Yeah.
potent, though. People get scared. I'm like, "It's not you can drive. It's fine. You're not gonna pass out." It's not like that. But it's like a nice gentle, like, okay. Because really people's cravings for wine are only like it's gonna be like 10, 15 minutes max. If you can get over that hump of intense
Yeah.
craving, it'll go away. And it's usually
Mm.
when you get home from work. You're gonna
Right.
crack it open, pour a glass, and start making supper. So if you can
Yeah.
get
It's that,
over
like,
that, it
association, right? Like, the
is. That's what
habit
I
and that
mean.
association of, like, you associate
Yeah.
the wine more with, like, the relaxing, the
Yep.
the winding down versus, like, the actual, like, alcohol itself, right? That's what
Exactly.
it
Well, that's
feels.
what I mean. Exactly. So if you can pour yourself a non-alcoholic version, your dopamine's going to go up,
Yeah.
which is going to make you feel better. And then if you also take L-theanine, the craving will go away and you'll feel calmer. So those two
I love that.
together, like it's a really good combination to just kind of offset all of that stress that you're having in the evening. Cause I do want women to unwind. I always don't take the alcohol away right away because some women are drinking a lot, like a little bit too much.
Huh.
We, slow it down. Or I say, maybe just leave it to a Friday night or a Saturday night. Right. Like, and I don't like to
Yeah.
take things away from people completely because, I don't love alcohol for people. Like, I'm not saying I don't drink because I do a little bit, but you just have to do it really carefully and in moderation. And you got to make sure that if you're going to set that boundary of having one glass, that you're sticking to one glass. Because
Yeah.
Mhm.
that's a huge issue that I find with women is like, well, I'll have a glass and then they end up drinking the bottle because they don't want it to go to waste because the next day it doesn't taste as good.
It doesn't taste good.
Like, listen, like, it's not a good excuse. But all the
Oh my
time, it's a
god.
legitimate excuse I hear a lot. So I'm like, no, and then they'll get a box of wine. And I'm like, no, don't do that, please. But
You know,
again,
obviously
it's
all kinds, right? All kinds of stories. Yeah.
all the time. And
Yeah.
it's because you're trying to numb the stress with something. That's what it comes down to.
Yeah,
Yeah.
exactly.
Right.
That's what I'm saying.
And that's what I mean. That's why a lot of women get put on antidepressants and anti-anxiety medications as well. And I mean, don't get me wrong, there's a time and place
Yeah.
for these things. But the problem with it is at that stage of the game, a lot of the issue is cortisol and it's also hormones. It's not a neurotransmitter issue. And that's what antidepressants and anti-anxiety are working on. They're working on your serotonin a lot of the time, right? And a lot of time the woman doesn't have an issue with serotonin, they have an issue with cortisol.
Mm,
So that's why women feel so numb when they're taking these things like sertraline or if they're taking like venlafaxine or something, or citalopram is a really common one. So the problem is it just numbs you. And then it's like, is that what you want? I mean, some women need it, sure, depending on the level of depression, anxiety, which a lot of the times I'll go through all those testing scores with them to see how bad it
right.
is. Cause yeah, some women do need it. I'm not saying you don't, but I would say majority of women, if we work on their cortisol and their lifestyle and diet, they're fine. They don't
Yeah.
need anything.
Okay, so
And
what
then
is the
hormones.
process like for you, Celeste? Like, so somebody comes in and they go, I'm not really sure what's wrong. They don't know they have they're in perimenopause.
Yeah,
How does that process look for them when they come into your office from the
right,
intake? And then what are some of the things that they need to do first before you diagnose
right.
those things?
So typically, if someone comes in, like I obviously see their birthday before they come in. So, if they're in their 40s or 50s, I know. Even if they don't
Right.
say it's for that, I'm like, do you have these symptoms? And then I go over the checklist a lot of the time. So it's an hour long, my intake. So it does take a while. So we go through everything. So we go through whatever, like some women, a lot of the time, someone who's going through menopause will have like gut issues, let's say from something else, or they have
Mhm.
IBS. So they'll come in thinking that's all they're coming in for. And we'll start going through things. And I'm like, well, I just don't feel like myself. And then I start going through the checklist of menopausal symptoms and they check all of them. And then we start working on that as well, right? So
Okay.
we're not regulated in New Brunswick, which makes it kind of difficult. So I can't prescribe right now, which is
Mhm.
really frustrating because I was prescribing in Ontario. But Nova Scotia just regulated us. So fingers crossed it's coming. But I do have really good relationships with most people's family doctors now because I've been doing it for so long. So most times I just fax like, let's say they need an estrogen patch and like progesterone or something, right?
Mm,
I'll like fax their family doctor most times and they'll be on board most of the time. They're like, yeah, because they know who I am now. They used to not be like at first when I first started this, it was difficult because they thought I was a witch and I'm not. Obviously, it'd be really cool, but I'm not. But if I was Harry Potter, I tell you, I would be doing some cool spells in here, but I can't. So most times they're on board, but I'll be managing them and I'm just go back and forth with their family doctor. But that's like a nice team approach too, though. Then they
yeah.
Yeah.
have both of us on the same side.
Right.
But I also do have a partnership with a local menopause clinic as well that I make referrals to. So menopause care. So they're in St. John. They're awesome. So
Yeah.
if someone's family doctor is reluctant or they don't have a family doctor, that's typically how we would do it. So there's
Okay.
always a way that we would get them on hormones, right? It
Yeah.
just depends on which route we take. But I'm hoping in the next year or two, we might be able to, hopefully. It would take a big strain off the healthcare system,
Yeah.
like a
It'll
big
get there.
strain.
It'll get there.
Fingers
Yeah.
crossed. But
Yeah.
that's usually how that part goes. And then obviously we go over all the health history. We go through, their stress levels, their sleep, digestive health, what they're taking for medication, supplements, all of that. And then I always have a treatment plan that same day. So that might involve supplements, it might involve botanicals, it might involve acupuncture, it might have some sort of, IV therapy or injection therapy that we do. Like It just depends, but it's usually like 4 or 5 things that we're doing at the same time. Sometimes
Okay.
I just throw the whole kitchen sink at the person, so I'm like, "How long have you been dealing with this for?" I'm like, "Let's go. Let's just throw everything at you."
See what
And
sticks.
then exactly, right? So and then I also have, I work with Lauren, who's a pelvic floor physio. She's amazing. A lot of women have pelvic floor issues, so I'll send them there. I work with a lot of really awesome chiropractors, so I'll send them there if they have issues. So and then therapists upstairs, Rising Tides is up there. We have massage therapists upstairs. So we have everybody in the same building. So it's a lot of referrals internally, but you have the whole team working on you at once, which is so important. So
It's like,
important.
yeah, it's a whole team, like a one-stop shop for
One-stop
any
shop.
hormonal support. I love it. I'm really
Exactly.
curious about this, Celeste, because I think when we talk about perimenopause and we talk about menopause, like every woman goes through it. Pretty much every woman goes
Yep.
through it, and it's something that's so natural and has been happening since the
The
since
dawn
we've
of
been
time.
around. Yeah. Dawn of time. I was like, what's that phrase?
I knew
But
what you
yeah,
meant.
it's been happening since we've existed here. And so to me, I'm like, why is it so damn like why is it so horrible for women? Like, why is it so horrible? Why is it so drawn out? Why is it so painful? Why is it like this big looming cloud that every single woman has to go through when it's something that's so natural? So to me, like, I always like looking at things from a holistic approach too. Like, take all the complexities out and like let's just break it down. Same as like taking out the processed foods and eating like whole foods. That will solve a lot of the problems in the body. So when we think about, menopause, something that's so natural, to me, I think to myself, I'm like, I don't think that we were always set up to have to go through such a long, drawn out, terrible experience. I think that over time, with the way that society has evolved to where we are
Yeah.
today, it has caused it to become that. So if we were to like go back hundreds of years ago, when most of us were not, both parents were working full-time jobs, where we're so busy, where we had technology, all of this stuff, right? That causes all the stress. And when we're eating shit food, like let's face it, most of us are eating crap food.
Mhm.
When none of that really truly existed, to me, I would think that menopause was probably a much easier transition because our bodies were in a much better state than where it is today. But because you're the expert here and you've been doing this for so long, I'm really curious to hear your take on that because a lot of the things you've
Right.
described are very natural and like that holistic approach
Yep.
as well. So
Mhm.
I'm
Right.
really curious to hear your take on that.
Yeah, so I mean, most women will definitely suffer, and they would have been suffering back then as well, but you don't have the environmental toxins that we have
Mm.
nowadays as well. Like, for example, they have so many what's called xenoestrogens in a lot of products now, so that would be like these really bad toxic type of estrogens that they bind to estrogen receptors much like a regular estrogen hormone would. So that
Mm,
can also play a really big role, and that's why boys are becoming more feminine as well. That is part of the scenario. And what I mean by feminine is like they're larger is what I mean. And not to say women are larger, but we have more fat on us. That's just the natural scenario.
mm,
But when boys are having more fat on, like young boys, like preteens, it's not normal, but a lot of it is because our processed foods and these
Oh, yeah.
xenoestrogens that are in endocrine disruptors are in everything too, right? And you got to be careful with that, the foods because of that, and food dye, for example. And,
Yeah.
just even just living nowadays in the air and the pollution is massive too, right? And then all these creams that people put on themselves and makeup and things like these all have a lot of these endocrine disrupting chemicals in them. So I think that's a big part of why things are getting worse. I also think society is just a lot more stressed out than
Mhm.
we
yeah.
used to be. I don't think we used to be this stressed out about everything. We also didn't live as long, to be fair. We used to die pretty early. But really, hundreds of years ago, we did just die from like anything, like because we had no antibiotics and things. So that is part of it. I mean, women's health has also been pushed to the wayside for a very long time. If this was a man's issue, it would
Yeah.
have already been
It's true.
solved.
Yeah. Because menopause is a taboo, right? Very taboo. Yeah.
And it's a lot more recognized now, and there's a lot more help for it, which is amazing. And I'm really happy about that. But the Women's Health Initiative that scared the crap out of everybody in the early 2000s, that was the study that had said that, it's going to cause breast cancer. right? But that study was not very well done. It's pretty flawed in like the dosing and the age group and like comorbidities, and I won't even go there. But it was not well done. But what happened in the early 2000s is anybody that was on hormones, they all immediately got off of them. Like doctors took them right off.
Really?
So yeah, so it's only been in the more recent, I would say like 5 years that things have started to come around for the better. So just last year, the Women's Health Initiative, because it's a longitudinal study and it continued, they basically found that estrogen can actually be protective against breast cancer instead of the opposite. And if you think about it, when do most women get breast cancer? It's postmenopause, not perimenopause. They get
Yeah.
it when they're over 50, when their estrogen is like no longer a thing. So it's like, how would
Right.
that cause it then? I'm not saying it's the same thing with women that get it early on and like estrogen positive. It's a whole different scenario. But that study did actually say that last year. So, and there is a type of hormone that can technically increase your risk more of breast cancer, and it's called medroxyprogesterone. So it's a synthetic type of progesterone that is still used nowadays as, you know, because you do need progesterone when you're taking estrogen unless you don't have a uterus. So if you get a hysterectomy, because what happens is if you have unopposed estrogen, your uterine lining will just keep expanding, and that can lead to endometrial cancer. So
Okay.
obviously we don't want that. So that's why we need to pair an oral progesterone. So the one I like the most, it's called oral micronized progesterone. So these are bioidentical hormones. So that would be like your estrogen patch as well, or estrogen gel, and then that type of progesterone. And what I mean by bioidentical is that it looks just like your hormones in your body. So it mimics them exactly versus the synthetic ones. They go in and they bind the same kind of way, but your body reacts better to bioidentical because it knows exactly what to do with it, right? So that is why they work so well and effectively for these hormonal shifts and for perimenopause symptoms. If your body knows exactly what to do with it, most women start to feel better in a few weeks of being on hormones. So
Yeah.
that was a very long
Oh,
spiel that I went
wow.
on.
You're so
Sitting here
smart.
and I'm just like thinking to myself, I'm like, I feel like maybe hormonal, was it hormonal replacements? Is that
Replacement?
Or
what?
menopause. So they're kind of they're shifting the name to menopause replacement or menopause hormone replacement therapy now. So I still call it hormone replacement just because more people know what I'm talking about.
Right.
Yeah, yeah.
So I still call it HRT.
I have a question for you actually, and I
Yeah.
feel like this is something that probably not a lot of women talk about, but also I'm like, I know a lot of women probably struggle with it, is like, as
Mhm.
I get older,
Mhm.
getting facial hair, like that annoying like chin hair that
Yeah.
you have to
Yep.
pluck every week. Is
Yep.
that because of hormones?
Oh yeah. So that's usually testosterone fluctuating. Yeah, so that can
Interesting.
cause a lot of that hair growth that's happening. And I mean, it's because it's fluctuating as well with estrogen and progesterone.
Yeah.
But I also really like women being on testosterone replacement therapy, honestly. So most women, I'd start them on estrogen and progesterone. And then let's say, you know, a few months later, they're still having sex problems.
Right.
Libido issues is
Libido.
humongous.
Yes.
Again, is that
Wow.
all hormones? No, it's also cortisol. Cortisol is a hormone, but I just like to differentiate to make it easier. Cortisol, I mean, if your body's in fight or flight, you're not gonna be like, "This is a really good time to have sex, let's go." No. Like, of course not. Men don't understand as much because like, their testosterone levels, like, they could have sex or they could be getting eaten by a bear, I swear. Like, I'm like, "You know what? That is chaotic, but it's true." Like, I'm like, "Stop. This is not the time." But for women, because you're taking care of everybody else, it
Mhm.
is partly a cortisol issue, but it's also a really big issue with testosterone levels. So I find if women are starting to notice that their libido is going down and they're also losing motivation to
Mhm.
do things. So, you know, let's say they used to work out at the gym all the time and now they're like, I don't really want to go, or you're getting weaker at the gym. Those are telltale signs that there's a testosterone issue too, which is super common. But not everybody's going to need testosterone. It really depends on, first of all, your goals. So, like, let's say, you know, you don't care to have sex, which again, I think is a very important part of just yourself. Even if you don't have a partner, it's very important to have a libido regardless.
Mhm.
Because the amount of women I'll ask them, like, they'll be single. And they're like, well, it doesn't matter because I'm single. I'm like, it's still important to have a sex drive.
Mhm.
It's okay to talk about. But again, I ask everybody.
Yeah.
So I'm so used to the conversation. But if someone's coming with that issue, then I'd be like, yeah, it's more you should be on testosterone as well on top of everything else
Mm.
because it can really significantly change your libido and your motivation, which is huge again because that's a big impact on your relationship. as
Mhm.
well, right? Which I see all the time. Like women are like, well, I feel
Yeah.
bad for my husband because he wants to have sex, but I don't. And again, after we go through the whole day, it's like, well, no wonder you just want to sit there and not do anything. Your entire day was jam packed with chaos,
Yeah.
literally from the moment you
Yeah.
wake up. Like, no crap. Like, I wouldn't want to have sex either.
Yeah.
So that's why we have to, that's why we have to work on everything. Like, it's not like we're just
Yeah.
working on a few things. Like, we got to work on the layout of your day, even, right?
Mhm.
Like,
Can we
it's
get
so important.
testosterone in a bottle or
It's actually a controlled substance in Canada, so it is harder to get than
okay.
estrogen. Nobody abuses estrogen, I will say that, but people will abuse testosterone. Well, that's what you see, right? Like when you see the guys at the gym, like they're, to be fair,
Yes.
most of those guys
Yeah.
are not just on testosterone, they're on like Dianabol and SARMs and like friggin' growth hormone. They're not just on tests. But anyways, that's
Yeah.
a whole other scenario.
That's a whole other episode.
It is. Men would be a whole other episode.
I'm learning that there are different, I guess, purposes for each of these different hormones. So estrogen,
Yes.
testosterone, and progestrogen. Is that what you called it?
Progesterone. Yep. Progesterone. Yep.
Progesterone. Okay. Okay. And
Mhm.
so I'm really curious too, is like once a woman's hormones are all, I guess, working in sync with one
Yep. And they're
another
feeling
and
better.
yeah, what are some of those positive signs that they can start to see?
I would say so let's say someone's coming with your classic perimenopause symptoms. I would say the very first thing that goes away is the hot flashes and night sweats. That's probably the very first thing, and that's the estrogen. And then women's health, their sleep typically gets better like right away with progesterone. Like
Okay.
right away, like literally within the first week, I would say most times. And then the irritability starts to come down. But again, the irritability comes down because we're also working on cortisol. So even before women get on hormones, I usually start working on cortisol, and their irritability usually comes down anyways, because a lot of the time, again, we're getting you out of that fight or flight and
Yeah.
we're putting you more into the parasympathetic nervous system, which is your rest and digest, which a lot of women are not in, which is why all these issues happen too, right? Because your
Mm,
body's never like, it's
Yeah.
never zen, it's always chaotic. So
Yeah.
those are the first thing that start to happen. And then, after a month, I'd say if joint pain was a factor, they'll start to notice the joint pain goes away. I would honestly, libido is probably the hardest one, I will say. Libido is the hardest one to actually come over. And I think it's part of because women's body image too. So if you had that weight gain too, you don't feel good about yourself. So let's say your stress has come down and you're on hormones, but that's still not there. I would say it's a body image scenario at that stage of the game. And then we have to work on that side of things too. Because
Yeah.
if you're not
wow.
feeling comfortable in your own skin, you're not going to feel sexy and
Mhm.
like, let's go. Like, you're not going to feel like that.
Right.
You're going to be like, oh, I just don't feel great about myself, which is so sad, but it
Yeah.
happens a lot. And that's why working on, and I hate to just say like weight loss like that, but I do think it's really important that we work on the weight loss, not only for that reason, but because there's adipose tissue, it's called, and it's around your organs as well. You'll have like this other big visceral fat and everything. And that's what I'm more concerned about than someone's like belly being larger,
Right.
right? It's like there's fat around your organs too, and that can lead to so many issues. Like fatty liver disease. It can also, it's a lot. It's a lot. So most people that come in, we're not just doing one thing, as you can see. And I'll
Yeah.
usually go over your blood work too, because again, people's blood work looks normal to their family doctor.
Yeah.
But then and again, I'm not blaming them because they don't have the time. The government literally is like, you have this much time with each patient. They literally don't have the time. I don't think any of them are out there to cause any harm whatsoever. I think they're in it for the right reasons. They're just so burnt out
Yeah.
because
Yeah.
they don't have the time. And that's why I went this way instead of the conventional ways, because I have a whole hour with patients. But that's another reason why it would be nice to take that strain off the healthcare system, because they wouldn't be so burnt out.
Yeah.
Right. So, but again, kind of circling back to that, to the weight loss side of things, that's why that part is so important. And then, going over their blood work, like the amount of women that I see that are iron deficient, for example, that have just never been told that, it's insane. So like ferritin, for example, that's your storage form of iron. They just changed the level. I think, was it earlier this year or last year? It used to be the cutoff of 30 and now it's 60. Actually, no, it's not. It's still 30. It used to be like 10, I think. That's what it changed to. But I don't like it below 60 if you want to feel optimal, right?
Mhm.
But I had, even just last week, I think I had 3 different women that their ferritin levels were below 15. And I mean, that can lead to hair loss, shortness of
Yeah.
breath,
Okay.
anemia, like, because that leads to anemia in the long
Anemia.
run. But then fatigue and brain fog is
Mm,
also huge. And so it's like, you
Yes.
got
I
to
feel like
correct.
we're all going through it.
That's what I mean, and, like, and it's the thing is, like, you know, they don't realize that that is such a big factor in things,
Yes,
or they feel
yeah,
dizzy all the time, they don't know why, and I'm like, "Your iron doesn't exist, of course it feels like that, right?" But it gets missed all the time. Same with
yeah.
fatty liver, that gets missed all the time,
But
all the
not
time.
necessarily if somebody's low in iron, they're menopausing, right? It could just
No, that's
be
just a whole other
something
side
that
thing
is a
that I went
whole
on.
different, like yeah, so it's like
Yeah.
the testing, the intake forms, the questions that you ask kinda leads you to tell them, "Alright, I think you're more towards a perimenopause." Yeah,
Exactly,
but a
right, because
lot of us
again
women go through those, like, those nutritional, like, deficiencies, and I
absolutely,
think
especially with
sometimes we don't
bleeding heavy,
know,
right?
right?
Yeah,
Yeah.
exactly, and people's period like, women's periods will change so much during
Yeah.
perimenopause, like, some people will start bleeding through their pants like crazy,
Oh my
like,
god.
insane heaviness will start to happen. Whether they have underlying, like, fibroids, for example, because fibroids basically, like, leech off of estrogen, and
Right.
again, if you're having these crazy spikes in estrogen, you're gonna bleed more because of it. Some women just don't stop bleeding. They just continue bleeding for like a year. I've seen that many
Oh my
times
god.
because they're where's the help? Takes forever. So they're super iron deficient because you're
Oh my
bleeding
god.
Wow.
nonstop. And then some women are go through it gracefully and they just when they're like, I don't have a period anymore. It is like insane how different everybody
Oh
is.
my god, just when you think it's
Insane.
over at childbirth. No.
It gets worse. I can't wait. I'm so excited. It's reverse puberty, guys. It's reverse puberty. Think how shitty puberty was? It's
I
reverse.
know.
It's
Like,
reversed. Okay,
it
so
sucks.
let's do a final note because you have to go. But let's
Mm.
say to any woman listening right now, Celeste, if they are, they're going through it. They're suffering mentally, emotionally, physically, and they just need some guidance today from you. So what would you say to a woman who's feeling all of those things and what she can do today to make
I mean,
herself feel
definitely
better?
come see
All right. I like that.
'cause that will help. The problem is because like I said, it's so multifactorial, no one's treatment plan is really the same, so it's
Mhm.
hard for me to give you, like, a generic information on that. I would say really think about what symptoms are happening, get more in tune with your body, start tracking your periods to see, like, what's happening with these now, and then, like, the top 3 items that I had said earlier with cortisol management and getting enough protein and then weight training, like, if you just start there even,
Yeah.
you'll notice a difference. For sure.
Hey, I think I have to start eating in the mornings.
Listen, Sherry, I will yell at you every day now.
I
I'm
also
just
think I
kidding.
need to come see you at some point because yeah.
Yeah, yeah, me
So,
It'll be
too.
yeah,
helpful.
thank
Celeste,
you.
It'll be helpful.
can women come and see you? Like, can you do online,
Yep,
intake as well?
We
Yeah?
do
yep, so
So you
online.
can
I
work
do
with
virtual as
women.
well.
We'll just add your links to the show notes,
Yep,
so anybody that
perfect.
needs to come see you, Instagram or your other links, they will
Mhm.
find them in there.
Perfect. Mhm.
This was so much information. I'm, like, already thinking about what
Sorry,
I
it's
need
like
to do
over
tonight.
it's a
No
lot.
watching TV before bed.
There's no wine on a Friday night? I'm just kidding.
Well, I don't drink wine at home anyway, but yeah,
You're good then.
I'm
You're
good
good.
there.
But I just dampened everybody's life now. If they listen to this on a Friday night, I'll be like, "Sorry, guys."
Yeah, me yeah, drinking the shakes
It's fine.
instead. Yeah.
Whatever works, right?
But
Whatever
Thank
yeah,
you
works.
so
thank you
much,
so
Celeste.
much.
Really, really
Thank you
Yeah,
guys for
appreciate your
having me
time
on. Yeah,
today.
no problem. I loved it. If you guys ever wanna have me on again, I'd be happy to come on
yeah,
because obviously I have way too much to say all the times.
we love it.
All the
You
time.
have a lot of, like, energy, so you probably take your nutrients and your
I
supplements and
try. But I also have ADHD, so it's like fake. It's fake.
yeah,
I'm just hyperactive all the time.
love it.
It's totally fine though,
Have
yeah.
a great rest of your day,
Yes.
weekend.
You guys as well.
Yeah,
Yes, have a really good weekend, and I mean, I'll see you guys in the soon
yeah, we'll
anyways.
chat
All
soon.
Yeah.
right. See you
Alright,
Awesome.
guys.
thank
Bye,
you.
Celeste.
Bye.